and I was in a group with Grace Vanderwater and Faith Arnold, and I'm going to be telling you all about Osteogenesis Imperfecta. So Osteogenesis Imperfecta, sorry, take my mask off so you can hear me, is a genetically inheritable disease in which the bones fracture easily, often with no injuries or a reason why this should be breaking. This disease is often called brittle bone disease because your bones will crack and crumble so easily. Symptoms in patients can present all kinds of different ways. It's a spectrum, really. And the reason for that is because there's so many different types of osteogenesis imperfecta. There's 8 different types. The first type, type 1, is the most common type that usually is the least effective on people. It causes bones to break, but it's not a life-threatening form. Type 2 is. Type 2 is the most dangerous form. It's not very common, but it's so dangerous because it develops in the womb and your bones are so fragile that most babies die during birth or right after birth because all of their bones break when they're born. It's not super important to know all 8 of these types. What is important to know is that in general, they all present the same symptoms. These symptoms include smaller stature due to malformed or bowing long bones, a curved spine that could be collapsed in the vertebrae or compressed even. Another thing to look out for are weak joints and weak muscles. Specifically, the joint that we look for that's weak is the neck of the femur in the hip. That's a telltale sign of osteogenesis imperfecta. Another thing that's common with this is jaw problems and oral health problems. That gives the patient with OI a more triangle-shaped face most of the time because they have poorly developed teeth and a poorly developed lower jaw. And a lot of times, actually, these people can develop hearing problems. Now, if you think about what hearing is, it's 3 little bones in your ear. And if your bones aren't formed properly, then sound can't transfer between them properly. Another thing to watch out for is a barrel-shaped rib cage because of misshapen flat bones, which your ribs are flat bones. And this can cause a lot of breathing problems in patients with OI. Another symptom that we often look for are underdeveloped membranes or poorly developed membranes. This means that your skin can bruise very easily and your eyes, the scleras, the white parts of your eyes, will often take on a color that they're not supposed to have, like blue, purple, or gray. The final thing that is the most telltale sign is bone fractures. People with OI have weak and brittle bones. Some may only break a few bones over their lifetime, but others may break hundreds of bones over their lifespan, including before, during, and after birth. All of these symptoms are caused by genetics and gene mutations. Most people inherit defective genes from only one parent. That would be the dominant gene for OI. This abnormal gene is stronger than the healthy gene. This causes the person to have OI. A person with the dominant mutation has a 50% chance of passing the disorder onto their children, but it will be present in their own life as well. In other forms, the child is given 2 smaller or recessive genes by both of their parents. This is called recessive OI. People with recessive osteogenesis imperfecta may not necessarily present OI in their life. They may not necessarily have it, but they have a higher chance of passing it on to their child. There's a 25% chance per pregnancy of a child with the disease, with the disease being passed on to the child. So I've been talking all about genes and gene mutations, but what is it necessarily that these genes control? Well, these genes control the production of collagen. Collagen is what makes bones hard and strong. When the gene is mutated, the body either can't make enough collagen or it makes a defective collagen molecule. This is what leads bones to be weak and break easily. Now, I don't do the diagnosing, I'm a nurse, but it's important that you understand how the diagnosis is done. The first thing that we do is have a physical examination. We look at medical records as well, and we look at family history because this is a genetic disease. And in the physical examination, in the medical history, we look at, are there any broken bones? How many bones have been broken over your life? And things like that. Genetic testing also falls under family medical history. Genetic testing, they usually will do blood testing to look at your genotype found in your blood. They'll also do x-rays and bone density testing, and x-ray can help see if you do have a broken bone, and bone density testing can tell them a lot about your collagen in your bones. This is what I can help with the most, your treatment plan and helping you understand what we're going to do to help you. Unfortunately, there's no cure for OI, but we can do a lot of things to help improve your quality of life. There's also no FDA-approved drugs, but we can also work with you to get a medication that can help your case. First, we'll offer physical and occupational therapy to help take control of symptoms and maximize ability to be independent in life. Some of the interventions that we can help with are strength training and exercise, and we'll teach you how to do that properly. One of the things that we like to encourage the most is swimming because it's low impact on bones. The next thing we'll do is educate you on how to avoid injuries during everyday activities. If injuries do occur, then we'll show you how to safely recover from them. Something that we also offer is education on hearing aids, where to get them, what's important for you, because a lot of people with OI develop hearing problems. Next, we will recommend you to pursue dental care. A lot of patients with OI end up having jaw surgery or have to have extensive trips to the dentist. Femally, if the patient is having difficulties walking because OI affects the long bones, the femurs, the tibia, the fibia, we'll offer things like walkers, canes, braces, wheelchairs. And another really cool thing that has been recently implemented in the medical community is, much like the surgery for scoliosis, they will surgically put rods next to bones to help them be stronger. So that's another option we can do. We can offer medications as well to improve quality of life. Mainly we'll offer pain medications to treat pain caused by the many broken bones and the chronic bone pain, the consistent bone pain. Bone strengthening medications are also given, but these are mostly to be treating other secondary conditions that can come along with osteogenesis imperfecta. Right now, some medications are being studied to help prevent complications in OI in adults and children, but that's something you'll have to talk to the physician more about, and they can give you more information on that part of it. Finally, the thing that we like to hound the most is that your diet is super important. You need to be eating foods that are high in minerals, high in calcium, high in vitamins, so that you can give your bones the best chance at being strong. Prognosis for patients with OI is really good. If they take our advice and make some serious lifestyle changes, they have a long and happy life ahead of them. Those with OI should follow up with a nutrition to come up with a nutritious diet, and they should also possibly talk to physical therapists to figure out an exercise regimen. Regular physical activity can help strengthen muscles and bones. Another really important thing is to keep a healthy weight. Being overweight increases the risk for many health problems such as diabetes and heart disease. Extra weight also adds more stress to bones, which is especially unhealthy for people with osteogenesis imperfecta. Another thing that I'm going to beg you stay away from is smoking and drinking alcohol. Smoking destroys your lungs, which you will already have a problem with breathing because of your rib cage being poorly developed, but it also weakens bones itself. And alcohol and caffeine's another one, I'm sorry, coffee, right? Caffeine and alcohol weaken your bones as well and can also lead to being overweight. The outlook for people with OI is generally pretty good, but it varies greatly depending on what type. The less severe symptoms don't affect life expectancy, but most OI-related deaths result from respiratory failure due to weak lungs and the rib cage being underdeveloped. The most severe types, like type 2, will result in death at birth or soon after. Another thing to watch out for is accidental trauma, causing a lot of problems like being in car accidents or things like that. Most children with OI live normal, happy lives into adulthood, despite numerous fractures, respiratory problems, restricted physical activity, short stature. Most adults and children will lead productive, successful lives if they diligently take advice and make lifestyle changes. If you want to get more information, this is where I got most of mine from, but you can definitely visit these sources yourself.